Dr. Gay from First Sec MRI, and this is a 50-year-old male who fell recently. He tore his rotator cuff, and I just did a video on the rotator cuff tear, but he also has a tear of his biceps tendon. So from the last video, we saw that he had a tear of the subscapularis tendon, which is the anterior component to the rotator cuff. There is a fluid-filled gap here. It's torn from here and pulled back. And the biceps tendon sits in the little groove here called the bicipital groove. And we just really don't see it very well. There's a little dark band here, which is part of the biceps tendon, that little linear band. So this is the biceps tendon that is torn, severely attenuated, and it's slipped out of the bicipital groove here, and it's hanging over this lesser tuberosity, or the medial lip of the bicipital groove here. So the biceps tendon comes off the top here of the glenoid. There's some area called the biceps labral anchor, where the labrum and biceps are together, and it comes forward. There's it right there, right here, and here it's again severely attenuated and it's subluxed outwards, and we see that little linear band here, and there it is there. So almost completely torn, but a little part of it's hanging on. And the reason it slipped out is because the subscapularis tendon, when it is attached here, it helps hold the biceps in place. It attaches along the lesser tuberosity, and there's a little band that goes over the top called the transverse ligament. And that ligament will help hold the biceps tendon in place. When the tendon tears like this and rotates or is retracted backwards, and this transverse ligament component is torn, then the biceps is allowed to slip out from its little cup it sits in here, and it can become subluxed or dislocated. Sometimes it's way over here, it's dislocated out. But when we see a tear of the subscapularis tendon like this, it's ruptured, then very commonly we'll find a tear of the biceps tendon as well, because it's lost its support from that tendon. So a tear of the biceps tendon, this is where the biceps tendon comes along here from the glenoid, comes over, makes a loop over the humeral head, and then comes down here. Very hard to see in this view. There it is right there. So it's not completely torn, but again, subluxed and severely attenuated, associated with the ruptured subscapularis tendon.